In this video, we're going to talk about a big myth that a lot of people believe about their wisdom teeth. The idea that they're the reason your other teeth are shifting or becoming crowded. It's a common misconception. So let's break it down. Hi there, I'm Dr. Luis Sánchez, and I want to welcome you to the Miami Dental Sedation Spa YouTube channel. This is where we talk about important dental topics, especially if you've been dealing with fear, anxiety, or just putting things off for longer than you like. If that sounds like you, you're in the right place. A patient comes in and says, "Hey doc, my wisdom teeth are pushing my teeth, and now my teeth are all crowded in the front." Another patient comes in and says, "I got my wisdom teeth out years ago, and look, my teeth are moving." Two different statements from two patients. One is false, the other one is true. Let me explain. As babies, in early development, as the bones are growing, in the face, mandible, maxilla, they're growing this way. They're growing towards a mid-face. Some reason, our body keeps that in memory, and there's always a movement towards the center, towards the midline. A simple explanation, if you get if you get a tooth taken out somewhere in the middle, the teeth are in front of it, ahead of it, are not going to move backwards. What's going to happen is that the teeth behind that space are going to want to move forward and close that gap. So that explains that over time, wisdom teeth in place or missing wisdom teeth, there's always going to be a movement towards the front. And if teeth keep each other in place. So as long as they're in alignment, it's completely good. But as soon as the tooth gets out of alignment, that's it. That force going towards the midline is going to push that tooth ahead of the others. And it could get so bad that you could have like 2 rows of teeth, just because, especially the canines, they're going to move forward and they're going to cover the lateral, which is the tooth in front of it. And then the dentist needs to make a decision what to do. So as soon as you see that your teeth are getting out of place, run to the dentist and try to come up with how to deal with that. And I tell the patients, look, once they come in and there's still, it's a little bit of a crowding, I tell them there's 3 things that can be done right now. One is you don't do anything about it, but now you know the reason why it's happening, and you know that it's going to get worse as time goes by. The second thing that you could do is we could do a retainer. A retainer is going to retain the teeth in place, meaning patient is okay with the way that the teeth look, but they're concerned that, they don't want to get them to get any worse. Okay, so let's retain them the way they are. You wear a retainer at night, and it's going to stay like that. The third option that I told my patients is, well, how about if we get them back into alignment, either through Invisalign or through braces, regular braces with brackets. We put them in the proper position, and then after that, you're still going to have to wear the retainers because teeth are going to want to move anyways. Okay? It happens. It's very common. Somebody comes in their late 20s, early 30s, and their teeth are getting all crowded and stuff. "Oh, but I have braces." I'm like, yeah, you have braces. Your parents probably pay for that first ortho treatment. Now it's your time to pay for the Invisalign or whatever you want because you did not wear the retainers and your teeth are going to move. It's very, very common. If you're ready to get answers about your wisdom teeth without pressure or without fear, there's a link in the description to schedule your free evaluation today. We will take x-rays, talk through your options, and build a plan that feels right for you. If you ever wonder how sedation actually works, or why so many patients finally feel ready to get care once they understand their options, click the link in the description and download your free copy of Sedation Secrets. This guide walks you through the different levels of sedation, what each one feels like, and how we tailor the experience to fit exactly what you need, no more and no less. Whether you're ready now or you're still thinking about it, just know this. You don't have to figure it all out on your own. When you're ready, we'll be here with the support, the sedation, and the kind of care that puts your comfort first.